Lovely patient, we've done one round of lipo 5 liters max, and you can tell the difference. We did a BBL, her butt is shaped better, not perfect. Today we're going to do the front, but we're going to get rid of this buffalo hump. If you guys see right here, this. And when you see it right here, it's this mass right here. We're going to use our old scar, and we're going to get rid of this, okay? So we are numbing our patient, lidocaine, epinephrine, and sodium bicarb. We've done a little bit of lipo, and we're at 500, and we still have the big hump to go. Guys, we got rid of this hump. This was 1.3 liters. Now you see this. Remember before, when we pull her neck down, everything's nice and good. And again, everything through her one scar that she had before, okay? Hey guys, here's a lovely patient. Again, a BMI 42. We've done lipo to her back, so a BBL. And now you see the front. Our goal is to get rid of all of this. We're going to do a Fleur-de-Lis. And the reason we do this is because if I were to pull this down, she's still really thick. So we're going to do this and this at the same time. So it's a tummy tuck going this way and a tummy tuck going this way. Okay? All right, guys. We're starting with some numbing, lidocaine, epinephrine, and sodium bicarb. Guys, so we're going to use this cannula, which we call Big Bertha. She is 10 millimeters, and it helps us to liposuction faster, more effectively, with actually less bleeding, okay? Hey guys, so she's not leaning. This is just the extra tissue. So here we have this. You guys see the difference? Okay. So we have thinned her out. Now we're actually going to cut this. And I do it differently than most. We're going to start at the top and work our way down, okay? All right, guys. So we are making our incision nice and low. And you see there's almost no bleeding because we've let it be numb for a while, okay? Here we have intestine. We have some momentum. You see how the fat looks differently, and then sub-Q fat. So this is a big hernia. You can tell she's got a horrible diastasis. You said when she breathes out, she literally looks like she's almost 8 or 9 months pregnant. So we're going to fix that today as well as this, okay? When people talk about visceral fat, this is literally visceral fat. This is omentum from a large hernia that we're going to put back inside little by little, okay? Careful. You can tell we fixed the hernia, but she still has this massive diastasis. And you see now that we've kind of fixed this muscle here, she bulges up here, but not down here, right? So now we got to fix all this, okay? Here are ribs, right here, ribs, muscle. You see it doesn't bulge at the top, at the bottom too much, but we still have our work cut out for us, okay? All right, guys, here we go. She's trying to stretch out my suture. So this isn't the hernia. This is just her diastasis. We push it back, and you see when she breathes, literally it's so tight it just wants to bulge out. So we're going to push it in and gently hold this. Now we close her fascia so it prevents it from bulging out. Here's a lovely patient, again, a BMI 42. We did what's called the Fleur-de-Lis. We got rid of this. We lipoed 5 liters to shrink her down as much as we could. We did a monsplasty. And here's the extra skin. You see all of this? This is where the belly button was. And now when we take this off, there you go. That's what she has left. Yes, she is waking up, but you can see how much smaller she is if you go here.